Hi everyone, you have had trouble passing urine. You were told it is just an infection. Then came dilatation, catheters, and still the problems come back. What if I told you that the root cause is not just being treated, it is being ignored by many healthcare systems? Today, we bust the myth of a temporary treatment and tell you about a surgery that does not patch the leak, it rebuilds the entire pipe. Let me paint a picture for you. Imagine a garden hose. Now pinch it, what happens? Water slows, pressure builds. The pipe may even burst. So that is exactly what happens when you have urethra narrowing due to a stricture. Now strictures are far more common than what you think. If I quote some of the studies and some of the demographics, it affects around 1 in 150 men globally, and the numbers are rising with more of the catheter use, sexually transmitted infections, and surgical trauma. But here is the kicker. Most are treated with quick fixes like dilatations or laser cuts without ever treating the underlying cause, scarred, non-elastic tissue. This is akin to cutting weeds without uprooting them. They will always return. Urethroplasty is not just a treatment, it is a proper reconstruction. It means rebuilding the whole of urethra using your own tissue with long-term success in mind. Data from the International Journal of Urology 2024 shows that the urethroplasty has up to 95% success rate, while repeated dilatations and internal cuts drop below 25% by the third year after surgery. Let's understand in real world term. Dilatation is like patching a cracked wall with tape. Urethroplasty is demolishing and rebuilding the faulty sections with steel. And here is what most people don't talk about. Urethroplasty reduces not just the symptoms but the risk of overall complications because of the urethral strictures like chronic infections, urinary retentions, bladder damage, sexual dysfunctions, and long-term renal function deteriorations. Now let's simplify the surgical jargon. Excisions and the primary anastomosis, we call it EPA, used when the size of the stricture is less than 2 centimeters and is in bulbar part of the urethra, where the scarred segment is cut out and the healthy ends are stitched together. And overall, in good health, the overall success rate is close to 95%. Think of it as like removing a clogged section of the straw and gluing the clean part together. Now, the other option is buccal mucosal graft urethroplasty, which must have heard about. Here, the graft from inside of your chick, which does not grow the hair and is moist, is used to widen your urethra or the stricture segment. The overall success rate is close to 95% for strictures which is more than 2 centimeters. Now in 2025, meta-analysis from EOA shows that the buccal graft outperforms synthetic or skin graft in flow rate, healing, and the structure-free survival. Now we also do stage repair or for pan-urethral reconstructions when the damage is extensive, such as in failed previous surgery, post-tuberculosis, or any history of trauma. It is like rebuilding a road in multiple stages, methodically staged, and ensures structural integrity. Now, lab-grown urethral tissues from the stem cell is now in very early human trial, a potential future for redo cases. Now, let's talk about some myths. Urethroplasty is risky or painful. In experienced hand, it is a single-time curative procedures with minimal complications and maximum satisfaction. You go home in 1 or 2 days and the catheter will be for 2 to 3 weeks with improved flow, confidence, and sleep. Exciting 2025 research from Stanford is exploring magnetic assisted stent removal post urethroplasty, reducing the need for cystoscopically entirely. Imagine a day when the urethral repair becomes scarless and sutureless. We are heading there. What most people don't realize is that these conditions affect the mental health, the sexual confidence, sleep pattern, work productivity, and even relationship. I have seen patients which come with the depression, anxious, and chained to bathroom. Post urethroplasty, they're all finally free. So if you are tired the cycle of repeated dilatations, catheter, ignored symptoms, it's time to stop living in the loop. Choose a permanent solution. Choose a urethroplasty and discuss with your urologist. Don't forget to like, share, and subscribe for more such patient first content, because real treatment starts with the real information. Thanks.